When should I start creating a stash? This is a really tricky question and is very individualized. If you're struggling with breastfeeding, you don't have to stash. Always prioritize feeding the baby today over feeding a freezer for tomorrow. If you are going back to work, I do recommend that you start stashing at least a couple weeks in advance because there are lots of different methods and ways to be able to stash. Remember, you do not need to have an overflowing freezer full of milk in order to have a good stash. You need to have enough for the first time that you're away from baby, because while baby is being fed, the expectation is that you would then be feeding your pump to replace that milk. So one way that some people will stash for going back to work is to be able to use a milk collector. They may leak a lot of milk during feedings or between feedings, and so using a passive collector or an active collector can be a good way to pull off a little extra milk. Now, how much do you need in your stash? You only need enough for the first time that you're away from baby. So if you're on an 8-hour shift, you only need somewhere between 8 to 12 ounces. If you're on a 12-hour shift, about 12 to 15, maybe 16 ounces. And then you would come back and feed baby. Now, there is variability in that. Depends on how many times a day baby is feeding, for how much milk you would leave. But again, you only need to have enough for the first time you're gone. So passive leaking is one way that some people can collect, although it is normal to not leak milk or not leak very much. It might take days or weeks to collect enough for that first time that you're gone, but that's one way. Another way is to be pumping that milk. Most people will find that if they pump within about 30 minutes of finishing a breastfeeding, first thing in the morning, they can collect a pretty decent amount. I expect that if you pump within 30 minutes of finishing breastfeeding, that you would pump anywhere from half an ounce to an ounce combined between both breasts. If you can do more than that, that's amazing. It means less pumping for stashing, but realistic expectation is small amounts of milk. Your body's making dessert milk. It thinks the baby is cluster feeding and would not then overfill that baby. First thing in the morning is when hormones are highest for making milk, so most people get the most at that time of day. You could also pump right before you go to bed if baby is sleeping a longer stretch overnight, or if baby only wants one side, you could pump the other side. If you don't want to mess around with your milk supply, doing occasional sporadic pumping just tells your body that baby's hungry. If you do get in a regular routine of pumping every day at the same time of day, you do increase your chance of creating an oversupply and telling your body that you need that milk consistently. So it really depends on your goal, how much you want in the stash, and how your body responds to different kinds of pumps. Now you know.